of Al Franken from Minnesota. Senate Democrats have gained a colleague and lost an excuse. Our number 3 story tonight, with Republicans threatening to block a vote on fixing health care. The Democrats now have the numbers, 60 votes, to steamroll a past Republican filibuster, possible Republican filibuster. But do they have the will? With Franken arriving in Washington next week, Democrats in the Senate now have enough votes on paper to prevent Republicans from blocking any vote they want with a filibuster. It takes 60 votes to end filibusters with a process known as cloture, essentially closing down debate and moving on to the vote. Democrats have more than 50 votes for health care reform, but the big question has always been, can they get enough votes to stop Republicans from filibustering? The issue, not just political, but intensely personal for millions of Americans, as President Obama witnessed at his town hall on health care today.
Basically, because of the damage that the radiation did in things, I'm no longer able to work, and I have no health insurance. Now I have a new tumor. I have no way to pay for it. The doctors will not see you without paying $100 or $150 to get into their office. I can get checked into a hospital, and under their engineer program, they will run tests and release me, but that costs a lot of money.
While Mr. Obama promised to address her individual situation, it remains less clear how far he will go on the national stage. One of the 2 independent senators caucusing with the 58 Democrats is now demanding the party close ranks to block a filibuster. We will talk with him in a moment. The other independent senator caucusing with the Democrats won his primary in 2006, saying, quote, "I can do more for you and your families to get something done to make health care affordable, to get universal health insurance." He then went on to win the general election, saying, "I have long supported the goal of universal health care." But now Joe Lieberman has joined a handful of Democrats who have cold feet about allowing a public option, raising the question, will Lieberman and other Democrats who oppose it still allow the senators who support it to have an up or down vote on something that most Americans already support? Joining us now, as promised, the independent senator who supports a public option and universal health care for that matter, Bernie Sanders of Vermont. Senator Sanders, thanks for joining us.
My pleasure.
If we stipulate that Lieberman and a handful of Democrats may be a lost cause for you on health care, who has the power to at least make them help you at least end a Republican filibuster?
Well, this is the way I look at it. I mean, as you heard at President Obama's town meeting today, we have a disastrous healthcare situation in this country. 46 million uninsured, more underinsured, 20,000 people dying every year because they don't get to a doctor on time, 1 million people going bankrupt because of medical-related bills. So I think what the last 2 elections were about, 2006 and 2008, was that the American people saying, we're tired of right-wing extremism. We're going to trust the Democrats to move us in a very different direction, including health care. And in my view, what the American people want, and what the polls show, is the American people overwhelmingly want a national health care program guaranteeing health care to all people. They want to make sure that people are not going bankrupt. And they want to make sure that we do it in a cost-effective way. And one of the key components of that, I happen to be a strong proponent of a single-payer system. I think that's the only way to really tackle comprehensive universal health care in a cost-effective way. That's not going to happen because of the power of the insurance companies and the drug companies. But at the very least, what we should be talking about is a strong public option to compete with the private insurance companies, which will look like a Medicare for All program, something like Medicare except for people of all ages, and you provide subsidies for low and moderate income people. My view is that it is wrong to say that it takes 60 votes in the Senate to pass a bill. It doesn't. It takes 60 votes, as you have just indicated, to end the Republican filibuster. Republicans are filibustering every other day on virtually every important issue coming down the pike. They want to do nothing. We now, with Al Franken on board, have 60 votes in the caucus. And my view is that every one of those people in the Democratic caucus should be saying to the Republicans, sorry, you are not going to prevent health care reform. We're voting for cloture. We're voting to end your filibuster. And now we're going to go forward and pass a strong health care bill which begins to address the very serious crises facing millions of Americans. What I also think is that if some of those Democrats, for whatever reason, choose not to vote for final passage, that's their business, and I can understand that. But the key issue here is stopping the Republican filibuster, and then if we end up with 52 or 53 votes in the Senate to pass a strong bill with, among other things, a public option to compete with the private insurance companies, that's good enough for me.
In other words, Democrats vote the way you want, but at least allow an up or down vote to take place. If that fails, why will it fail?
Well, you know, in my own view, we should not be naive about what goes on in Washington. And that is the reason that we pay the highest prescription drug prices in the world, the reason we are the only country in the industrialized world that does not have a national health care program is largely attributable to the enormous power and money of the insurance companies and the drug companies, who in the last 10 years have spent hundreds of millions of dollars in lobbying and campaign contributions. I think right now they're spending something like $1 million a day to prevent us moving in the direction that the American people want us to move in. You know, one of the problems that I just have a hard time understanding, there's a recent poll out by the New York Times that said 72% of the American people want a public option to compete with the private insurance companies. They want that choice of going outside of the private insurance companies. 90% of Democrats wanted that option. So to me, it seems like a kind of no-brainer for the Democratic caucus to at least say, we're going to stop the Republican filibuster. The Republicans don't want to do anything. They are not serious about health care reform. That's fine. Let's reach out to them. Let's try to bring them on board. But if they want a filibuster, we're going to say no to that filibuster and move forward and do what the American people want.
But on that point, on the power and influence of the insurance industry and their lobbyists, at some point, if it's necessary to get a good bill passed, isn't there a responsibility on you to specifically start naming names and say he or she is selling us out to big insurance?
I think it's more complicated than that. I mean, I think you have conservative Democrats who are conservative in a number of issues for a number of reasons. So I'm not going to ascribe motives to those people. But all I am saying is that right now I think it is reasonable, given the fact that the Democrats have been given the responsibility for moving this country in a new direction, certainly including health care, that at the very least every Democrat should be able to say, look, the Republicans don't want to accomplish anything, and we're going to end that filibuster. And at the end of the day, I may not end up voting for a strong piece of health care reform legislation for reasons A, B, and C, and I want to explain it to my constituents. That's fine if people do that. But I think that given the fact that we have a strong majority in the House, we have a Democratic president, we now have 60 votes in the Democratic caucus, at the very least, every Democrat should stand up and say no to the Republican filibuster and allow us to go forward. And if they choose to vote against the final passage, that's their right.
And of course, it would take getting every Democrat to do that. Do you think that you would get that?
Well, that's what I think we should. That's what I think we should have, and that's what I'm fighting for. And you know, at the end of the day, if we can rally public support for a strong health care reform piece of legislation, you may get a couple of Republicans as well. I think the American people know that there's something wrong when we are spending twice as much, almost twice as much per person on health care as any other country, and yet our health care outcomes are not nearly as good as many of our international competitors.
Senator Bernie Sanders of Vermont. Senator, thanks so much for your time tonight. We appreciate it.
Well, thank you for your interest in this issue.
You're welcome.